at the end of our Allied Health Week, and we are so happy to have you here today. We have a beautiful class from the north. If you folks want to put your camera on and give a wave, that would be lovely. I will say that the north has been probably our most attended students and teachers, so thank you for that. And we're from South Esk Regional High School. And maybe your camera's not working, but we know you are there. There's in the chat. We do not have a camera today. Sorry. No worries. We're just happy to have you. So you guys are from Sunny Corner, grade 7 French immersion, and a grade 7. You have 7 students today and usually 8. So we typically always have a student out. So we are very blessed to have you and very grateful to have our very special guest to talk about their career and their career pathway. It's something that I know very little about, but I do know that I love fashion. So I'm very excited to hear more about the career of Opticianry. And I know that I can't say that very well, but that's okay. It's a start. But without further ado, I am going to hand it over to NBCC instructor, Christy Walters.
Thank you. Hi, everybody. So I'm Christy Walters, and I am the coordinating instructor for the Opticianry program that we are newly offering this year at NBCC in Moncton. So I'm going to get started and tell you a little bit about my career and why I love it. All right, so I'll tell you a little bit about me before we get started, and then I'll tell you about a day in the life of an optician, what it takes to become an optician in New Brunswick, the skills and experience that you'll have, and then we'll just kind of summarize it at the end there. So first of all, so my name is Christy Walters. I've been an opticianry instructor off and on for about 5 years now. When I first went to university, I actually went for a completely different reason. I wanted to be a social worker, so I enrolled in university. But while I was taking my program in university, I started working in an optical just because I needed a part-time job and I knew somebody who worked in one. I didn't know a whole lot about what you did in an optical, but I was like, it'll be a fun experience. And then what I actually discovered was how much I loved working in eye care. So I ended up changing my entire career path based on that, which was very interesting and a little bit surprising. So teaching opticianry is combining the two things that I really love, which is eye care and mentorship and education. So I love teaching people about my career. I love being an optician instructor, but I also really love like the eye care, healthcare mentality. So combining those two things is really awesome, and I love that. So I spend most of my time outside of work with my family. I have 2 boys. Their names are Arthur and Henry, and I have a pup who is almost 1. His name is Teddy. In my spare time, I like to use my Cricut to create things, and I love being creative for my kids' birthday parties. So if you look at one of the pictures on the screen, that's just the birthday party I just did for my son. He turned 4. My creative outlet doesn't really relate to my career, but I think the creativity side of things overlaps and can kind of help me be the best instructor that I can be. So my greatest achievement to date is getting this opticianry program off the ground. So I actually pitched the opticianry program to NBCC a year and a half ago because I felt like we had a huge need for an optician program in New Brunswick. And the one that was offered previously got, it kind of ended during COVID because they didn't have enough enrollment at the time, but I felt like we really needed one. So I reached out to NBCC with a colleague of mine, and we told them all about why we thought we needed an optician program in New Brunswick, and here we are. I'm very organized and driven, and I have a huge passion for my industry, so education is just kind of the natural step for me to move into. All right, so I want to play this video. I'm hoping we'll be able to hear the sound.
I don't hear it.
Don't hear it? Okay, I was worried about that.
So V, when we share, we can put on the sound, I believe.
Yep. So if you just close sharing screen and then reshare, and then when you reshare, there's going to be this kind of drop down panel that says include sound. Maybe just toggle that on and that should work.
Okay, let's have a
Sorry, folks, will just be a minute.
I don't see the include computer sound. There we go. Maybe that will work. Okay, let's try this again.
Moment.
Yep.
Come into my world for a moment. My world is a place made of math, science, art, and life, where light rules and optics are the law, a place where opticians are knights and their shields are polarized, where light is bent and prisms make a spectacle of themselves. I bring the beauty of the world into focus, from the smallest details to the smiling faces of your loved ones. I help you see the world better. I am a light bender. I am a vision defender. I am a gatekeeper to the windows of the soul. I am an optician, and I love my job.
So that was just a little video an optician in Ontario actually put together, and she posted it on the Become an Optician website, so you can see it at any time. But an optician, actually, before I get started on what an optician is, I just wanted to ask a question. So if we want to open like menti.com, just let me see if I can go back to where I have that. I'm just going to throw this in the chat and then hopefully we can open the link. And the code. So one 965-1633. So there's the Menti code. So if everybody wants to open that up, I have a question I want to ask everybody about whether you wear glasses or contact lenses. So you can click yes or no. Okay, so perfect. So we got some answers there. So that's great. And then I'm going to go to the next slide. So we have 4 people that say yes so far. So that's great. So some people are wearing glasses. Now, the next question on the Menti is, have you heard of an optician before today? So has anybody ever heard of an optician before today? Okay, that's wonderful. So an optician is defined by the Opticians Association of Canada as a licensed professional that's trained to help you achieve optimum vision with the application of eyeglasses, contact lenses, and prosthetic ocular devices. So what that means is that a licensed optician has taken some type of training, usually between 2 to 4 years, to fit people with eyeglasses and contact lenses as an option, and then ocular devices. So that one's a little bit more specialized, but it is something that we're able to do. So if you wear glasses and you've been to an optical store to buy glasses before, you probably dealt with the optician there. So they would have fit you with the eyeglasses and taken the measurements. All right, so let's learn a little bit more about this. So like I said earlier, I'm the coordinating instructor for the Opticianry program at NBCC. I've been working in the eye care field for 16 years. So it's been It's been a while now. I started working in an optical as a receptionist while attending university full time. And like some of you, I didn't even know what an optician did at that time, but I knew that I really enjoyed the fashion aspect of helping people find the perfect eyewear. So that's kind of what got me interested in the beginning. Right now, the big topic of conversation in our industry is dry eye. So I actually attended a dry eye summit a couple weekends ago, and it was amazing because I learned all about dry eye and how to help people improve their dry eye, which was very, very interesting. Now, I love teaching so much, and sharing my knowledge about my field is exciting because I love to share my passion for my profession with other people. Now, the most challenging part of being an instructor, I would say, is juggling a lot of different personalities because you have to sometimes keep the peace as an instructor. I love for my students to express themselves in class. We have to do so in a respectful way. And it's similar when you work in an optical because you have different clients coming in every day and they all have different personalities. So sometimes you just have to learn to work with those different personalities, which can also be a very interesting part of the job. Now, when it comes to being an optician, you do need to be able to talk to people because they're looking for your expertise when it comes to choosing the right product. So when they enter your optical, they're going to have questions and they're looking to you to give them advice because a lot of people get overwhelmed when it comes to choosing eyeglasses. Now, depending on how busy where you work is, I find like you usually build a type of rapport with your clients. So once you do that, they'll generally want to come back to see you over and over again. And that's kind of how you build your client base. When I look back, I wish I would have learned about this industry earlier than I did because I probably would have started my career in eye care immediately rather than kind of going into it in a backwards kind of fashion because it's so interesting to me and I would have loved to get started even earlier than I did. Now, most opticians work in an optical store, but that's not the only option. You can also work in an ophthalmologist or an optometrist's office. So an ophthalmologist tends to do eye surgeries and an optometrist does the eye exams. You can also work in a laser eye surgery clinic, or you can open your own optical store as well. We're actually one of the few professions where opticians can operate and own their own optical without having like an optometrist or an ophthalmologist. So we can do everything in the optical ourselves, which is great. Most optical stores run on a Monday to Saturday schedule. In New Brunswick, they're actually not allowed to operate on Sunday. So no optical in New Brunswick can be open on a Sunday. A typical optical usually opens around 9 a.m. and closes anywhere from 5 to 9 p.m. And generally you'll alternate Saturdays between staff. So there is a really nice work-life balance when it comes to being an optician. So how do you become an optician? Well, currently, most of the programs are 2-year diploma programs in dispensing. There's an option to take your contact lens certification separately. So that means that you're allowed to fit contact lenses, which are considered a medical device. So they're a little bit more specialized than eyeglasses. To stay current in my industry, I do a lot of professional development, and there's also a yearly minimum number of continuing education credits that you need to meet competency standards. So I did my eyeglasses diploma from 2012 to 2014. And then I decided to do contact lens certification in 2019 to 2020. So I did that one a little bit later, but that's perfectly fine. You can do them right in a row, or you can do your contact lenses later. It's completely up to you. And I did those through an online program called at a school called NATE. It's the Northern Albertan Institute of Technology. And until we had a program in New Brunswick, that was the only way to become certified as an optician in the East Coast. Currently, I'm actually taking my Master of Education in Adult Education through Yorkville University, just because I wanted to increase my skills as an instructor. So that's why I decided to do that. In a typical day as an optician, you can see anywhere from 1 to 30 patients. It really depends. I've had days where I see one person the entire day, but then I have other days where I'm kind of run off my feet a little bit because there's so many people in the store. This depends on the traffic in the area and whether you have an optometrist testing eyes. So normally if you have, we call it a doctor day. If you have a doctor day, you'll be a lot busier than if there's no doctor on site that day. I usually spend about an hour with each patient from start to finish. But again, that depends on how busy the store is and how many people you have waiting, because you'll tend to speed up your time a little bit if you have a lot of people waiting for you. We discussed the prescription requirements as well as what their goals are for their eyeglasses. And once products are chosen, measurements need to be taken for each pair of eyeglasses. So there's a lot of specialized measurements that we have to take for eyeglasses that a lot of people don't think about. But that's really what the most interesting part of the job is, because you know what the best thing for their vision is, and you get to recommend that. And it kind of like changes a person's life, really, if you think about it, when you're fitting them with glasses that fit really well and that they can see really well with. We're going to do the last mentee slide now. So based on what you've heard today, what part of opticianry is the most exciting to you? So you can just put in any words that you think are most exciting. You do for a living, then you never work a day in your life. And so that's basically how I feel. I'm excited to go to work every day because I get to make a difference in people's lives. And being an optician is a fun and rewarding career, whether you're teaching the opticianry program or you're fitting somebody with eyeglasses, you get to make a difference. And that's what I love about healthcare in general, but that's what I really love about being an optician. So if anybody has any questions, I did put my email in the slide. So it's christy.walters@nbcc.ca. And I would love to answer any questions that you have about opticianry at any time. So feel free to reach out.
I'm on mute. Thank you so much. That was so lovely and exactly what we are looking for. A very quick glimpse into your job and what you do. Clearly, you are very passionate about your job, but I do want to open up the floor. Ms. Quinley, if there's anybody in your class that wants to answer or ask questions, you can either type it in the chat or you can come to the mic and ask the question. While you're thinking of questions, maybe students, I have a question. So I suffer from dry eyes, and something that started when I was working in administration at Fredericton High School. And I believed that it started with a vent that was coming down on my desk constantly all day long. And everyone said, no, no, no. I left the office and my dry eyes went away. So wondering, is that a big cause of dry eyes? Is air conditionings, humidifiers, like what does that look like?
Definitely, it's definitely something that is kind of affecting it. Computer use even can cause dry eyes, because anything that involves a situation where we blink less is going to increase your dry eyes. Now, there's also like a genetic component to dry eyes. So some people are more predispositioned to get dry eyes. I have extremely dry eyes. I've never been able to wear contact lenses for a lengthy amount of time. And then recently at the Dry Eye Summit, I actually had something called a myography done on my eyes, where they look at like the glands that secrete your tears, and mine are very there's a lot of loss there basically. So that makes it really difficult, but there's a huge variety of factors, and it's actually really difficult to diagnose like what caused the dry eye.
And your number one solution for dry eyes is what?
honestly, like the most important thing is blinking. So I have like a 20-20-20 thing I recommend. So every 20 minutes, you need to look 20 feet away for 20 seconds. Because it causes, like, when we're looking at a computer, we tend to focus, and so we don't blink as much. So if you like look 20 feet away for 20 seconds, you're naturally going to blink a little bit more, and that will help a lot. But there's also dry eye therapies nowadays that you can do, but that has to be through an optometrist. And they do like light therapy and radio frequency, and it really, really helps. So I'm actually starting my own dry eye treatment here shortly to see if I can improve my eyes a little bit.
It's very similar. I do a lot of work with breathing. It's very similar when we're looking at a screen, we tend to hold our breath. So students, I'm going to answer that question in just a minute, but let's do the 20-20 and let's look away from the screen for a minute and blink. You said 20 times, Christy?
So you look 20 feet away for 20 seconds, but
Okay.
you'll just naturally blink.
And while you're doing that, let's take deep breaths, because that also helps with our nervous system and brings us back to a grounding state. I love this. This is going to be my new routine. Thank you so much.
Oh,
So
you're
there's
welcome.
a question in the chat. It says, why when you are in light, your vision is fine, and in the dark, you see pixels like static, but black and dark green? Static TV, but black and dark green. Callie.
Okay, so
thank you, Callie.
Our eyes are like made up of like rods and cones, okay? And so certain ones see better at night and certain ones see better during the day. So it really depends on like which ones your vision's made up of. So some people have really good night vision, whereas other people struggle a little bit more with nighttime vision. It also has to do with the size of your pupils. So if you have really large pupils, generally you'll see better at night because your pupils get smaller automatically in the dark. But if you have really large pupils, then they don't get as small as if you have small pupils in the light. So that's kind of why. There's no like, it's not that you're not seeing like the same acuity so much. It's more that like the darkness is kind of like hampering like your like how clearly you can see, but your vision is still working just as well. It's just that it's dark.
Okay. Good to know. Excellent. Any other questions out there from the students? Certainly, Christy is here and would love to answer any other questions. While Ms. Quinley is typing, another question on my end is sometimes eyes get red, and it could be allergies, it could be different things, but is there something that you can do to decrease that redness? And I know some people use drops like Visine, and I'm just worried about using anything on my body that's not necessary. So is that something you want to be careful about?
Yeah, so I don't recommend Visine generally just because it has a lot of like preservatives and whatnot in it. If you're gonna use something just because your eyes like are like a little bit red or dry, we usually recommend like a saline drop that you can buy from like the optometrist office. Those ones are usually more recommended and you won't get like accustomed to them. So with Visine, your eyes can get addicted to adding the tears. And then you stop making your own tears. So it's better to use the ones that are optometrist recommended.
Okay, we're having some great questions come in. It says another question, how do contacts work?
Okay, this is a fun one. So contact lenses are basically like, it's like a tiny piece of plastic, but it's like made out of silicone. So usually, or like some kind of silicone compound, and they're very soft nowadays. They used to be hard, but we don't really sell hard lenses anymore. It's mostly soft. And they have your prescription ground into them. So like the way they make the contact, they like put the prescription on one surface, and then you put the contact lens in your eye. So normally what we will do, like an optician will show you how to put the contact lens in, but you have to like hold up, I'll just demonstrate. So you have to kind of hold up your upper lashes, and then with the contact lens placed on your finger, you just pull down your lower lid and then you place it right on your eye. Can everybody see that? Just kind of like that. And then you have to move your eye up and down while it settles. And they just drape right over your cornea, kind of like this. and they stay there all day long until you remove them, and then you can see clearly without glasses.
Wow. And does it freak you out to touch people's eyeball?
I don't love touching other people's eyeballs because I'm kind of like a germaphobe, but touching my own is fine. So
Okay.
it's not often that the optician will touch somebody else's eyeball. Like, we normally only have to do it if they get the contact lens stuck and they can't get it out or something. Like,
Okay.
we'll have to remove it. But normally I show them how to do it themselves.
So we have a couple more questions. How come some adults don't see well to drive at night?
So that comes back to the whole like pupil thing and the rods and cones. So some people just don't have the genetic makeup to see well at night. Also, if you have laser eye surgery, that can affect your nighttime vision as well, because I'm not exactly sure what like the proper wording is, but it can like eliminate some of the like things that help you see well at night. So it really just comes down to like genetics and then like your surgery history. There's really no other reason like other than that. So it's mostly genetics why you don't see well at night.
Okay, next one is, how come blue eyes are more sensitive to light than brown eyes?
Ooh, these are some tough questions. So blue eyes, because they're lighter, they're going to absorb more light. And so that's why they're kind of more sensitive. It's honestly just because of the color. So like the darker the color of your eyes, the less they're absorbing. So blue eyes are way more sensitive just for that reason.
I didn't know that. Wow, interesting. Okay. Is there a difference in vision between glasses and contacts?
So theoretically, no. You fit the same prescription. Now, sometimes with contacts, we can't get the prescription to the exact same correction as with glasses, because contacts can't correct astigmatism as well. So more football shaped than basketball shaped, you'll have an astigmatism. And we can't fully correct an astigmatism in contact lenses. So you could have slightly better vision with glasses for that reason. Now, some people find they see clearly with contact lenses, but it's only because they're sitting directly on your eye. And so you don't have that depth perception that you have with glasses. Like, it's a little bit different. So it really depends. Like, if you're used to wearing contacts and you switch to glasses, you may find your vision's better with your contacts, but then the same thing happens the other way too, if you're used to wearing glasses and then you put contacts in. So the vision itself is the same, but you may experience the vision in a different way.
Awesome. Thank you. And I'm going to repeat what Ms. Quinley's class is saying. They said, thank you so much. We love your presentation. I agree with them 100%. And thank you for being so engaged, Ms. Quinley's class. This has been lovely. I feel like everybody got to ask a question. And this is exactly what these sessions are all about. Certainly, we hope that you sign in. We have a session this afternoon and 2 tomorrow as well. But Christy, thank you so much from the Center of Excellence for Health. We feel very grateful and also excited to learn more about your career. And I feel like there are so many opportunities for opticians to work, not just in, like you said, a clinic or a facility or a school. There's lots of different opportunities. So it's not just picking one, and you never know where that career is going to go. So thank you for being such a passionate instructor at NBCC. We're very blessed to have you in our province. And also thank you for presenting to the students of New Brunswick. And hopefully, if you have any more questions for Christy, you can certainly reach out to me or reach out to her, and she would be happy to answer those questions. So without further ado, I'm going to sign off. Make sure you take time to get outside today and enjoy the beautiful air. Make sure you take time to every 20 minutes, look away from your screen, look 20 feet away, and take 20 deep breaths. We'll add that on, and enjoy your beautiful day. Have a great day. Thanks so much.
Thanks for having me. Bye.